Germany has relatively few deaths from coronavirus, and many people ask why. And the country is not immune from pandemic. So what explains his current low fatality rate? And countries across the European continent are in lockdown. Borders are closed off. Healthcare systems are dangerously overstretched. Economics are contracting, and people are dying in terrifying numbers. And here's much the same. And so, not in full lockdown, schools, shops, restaurants, theaters are closed. Gathering of more than 2 people are banned. And the economy will shrink and jobs will be lost. And even the Chancellor Angela Merkel self-quarantined after learning that his doctor was infected. Of course, he tested negative. So Germany seems is not immune to the ravage of this pandemic. Except in one way, very few people seem to die. And let's have a look at this case report. And this is data from March 29th. We just see the case for Italy and Germany. So as March 29th, and Italy total cases about 97,689. And Germany have 62,435. See that only difference is less than 1.4 times difference, and total numbers only about 20,000 different cases. However, and in Germany only have 541 deaths, and in Italy there are 20,779 deaths. So there's a more than 10,000 difference, and close to 20 times difference. And when you look at this deaths per 1 million population, Italy the number is 178, and Germany's number is 6. So this again have 30 times difference. And if you calculate this fatality rate, and Germany just have about 0.8%, and Italy has more than 10%. It's a huge difference. The startling number difference are something of really enigma for all of us. And we try to find the reason why there's so big difference. I did some research, and here I just summarized the potential reason for the huge difference and why Germany have so low death rates. And the most important thing is testing. And Germany have highest test rate among the European countries. They test early and they test persistent. And so we are fighting war against the virus. And the virus, we don't see it. It's unseen enemy. So in order to win this war, we need to identify where the enemy is. So the only thing so far we can do is to identify the virus and to see where this virus are. And so that is the first step. Again, to test early, to test persistently, and to test as much people as possible. That's maybe most important and factor that contribute to the low death rate, because test far more people than any other European country. And it is apparent that large number and probably a big majority of all coronavirus cases never made it to official figures because they are not severe enough for hospital treatment. And the more widely the country tests, the more these mild cases you will find. Since the most severe cases are almost always tested, the number of coronavirus deaths will likely stay the same. So the net effect is that more tests lead to lower looking death rate. And that's the case in Germany. And on the other hand, in Italy, and they reserve the resource for the very sick patient. So they only test people with severe diseases. So that's my major contribution factor to this country's more extensive and higher death rate. So both early testing and persistent test, and so identify more young people so the usually young people will have mind symptoms, so they're not going to die. That's why the fatality is so competitive now. So in general speaking, countries that test less and reserve it for those already very ill, for example, in this case in Italy, they have higher fatality rates. So after testing, so you identify the enemy, so then you can track these people, so to see who these people contact. And so then you know the virus are, so next step you start isolation and also start quarantine. So in this case, then the virus has less chance to spread among the population. And so that's maybe most important is testing to identify the enemy, and then you track the people which are positive and you see how many people you contact, and then you quarantine the population which have potential carry this virus. Another fact is protect all citizens. And Germany did very, very good job, has also been bad at protecting its all residents because they have a much greater risk. Government banned visits to the elderly, and policymakers issued urgent warning to limit contact with old people. And so the result is very clear. And patients over age 8 make up about 3% of the infected, even so that they count for 7% of the population. In Germany, the median age for those affected is estimated to be 46. And in Italy, the middle age is 63, so it's a huge difference. Another important fact is Germany have, of course, the financially strong, so they have very good healthcare system. And so they have the human power, and also they have medical supply. And Germany have a unique system for its healthcare system. They have both public and private options. And they invest a lot of money to build up the healthcare system. And that's also very, very important factor. Finally, is the many people think that Germany is an early epidemic cycle. We know that Germany is about 2 to 3 weeks late than Italy. And that may be the reason. So maybe the virus was spread and 2 or 3 weeks late. So maybe after 2 or 3 weeks, we can to see the case or fatality case will be increased because the more old people suffer from this disease. And that's my thought for today. I will see you in my next video. Bye.